Dr. Azim Lakhani, resident representative of the Aga Khan Development Network, Mr. Ferozi Razul, if I get the names wrong, forgive me, I'm from Nyeri, president of the Aga Khan University Hospital, Dr. Carl Amrain, the provost of the Aga Khan University, Dr. Sean Buloki, my friend, CEO of the Aga Khan University Hospital, diplomats present, government officials present, all invited and distinguished guests, ladies and gentlemen, good evening. I want to start by bringing you greetings from the lovely people of Nyeri County, and perhaps to start also with a testimony that I am a beneficiary of the Aga Khan University. Just last year in June, I remember my mother called me and she said to me, Shiro, she calls me Shiro, which is a short for Wanjiru. She said, Shiro, I can't walk. It was about 9 a.m. in the morning, and I knew the fact that I had ventured into politics had begun affecting my mother. And so I called my friend Sean, and I said, I think my mother has a stroke. So Sean was very calm about it. He said, what you do, go fetch her and bring her to the Aga Khan University Hospital. And I did exactly what Sean asked me to do. And we actually carried my mother into the car and drove straight into the Aga Khan University Hospital in Nairobi. And what really took us in with my mother is the fact that we found Dr. Sean Buloki with a wheelchair waiting for us at the emergency. Let's give him a hand. See, I said, you see, CEOs do serious things. They just don't trolley people around. What kind of CEO are you, Sean? Go back to the office, you know. And he introduced me to, I don't know if she's here, Dr. Pretty, a very pretty doctor called Dr. Pretty Jabal. Introduced me to that doctor who's looked after my mom from since then. Within a day, my mother could walk again, and all she needed was a little bit of exercise and a little bit of supplements, and she's walking from then until today. Dr. Pretty checks on my mother every other day. They have conversations that I do not know what they're talking about. So for that kind of extended care, I want to thank the Aga Khan University Hospital. As a politician, I must bring you greetings, and I think I have brought you greetings from my people and from my boss, the governor of Nyeri County. I thought that's important before I get into my speech. It's my pleasure this evening to join you for this 60th Anniversary Gala Dinner. I'm indeed excited by the structure of this event. It would have been great to just sit here and listen to the Aga Khan University Hospital, telling us about the great things that they have done over the last 60 years. However, if you have noticed, they did something even better. They allowed us to feel the impact. Not only have we heard about the great stories of impact that we have seen and touched them. Allow me a few minutes to reinforce the messaging of this event by sharing a few impact stories from our own Nyeri County. Ladies and gentlemen, the Nyeri County has been privileged to have a good relationship with this hospital for a long time now. Over the years, more than 10,000 people from Nyeri County have benefited from the great work that this hospital does through medical camps. Through this, they have received quality health care from some of the best experts in the country. However, what excites me more about our relationship is the work towards improving our facilities and human resource, therefore guaranteeing impact at the grassroots level. Allow me to highlight just a few of these initiatives. Last year, the Aga Khan University Hospital renovated our 16-bed orthopedic ward at the Nyeri County Referral Hospital, our Ward 7. This fully equipped facility is now ensuring that our patients are recovering in a comfortable environment. And since the reopening of this ward, we have served over 400 patients who have received orthopedic treatment and surgery at the hospital. The cancer scourge is a burden to many families across the country and especially across Nyeri County. You all remember that Nyeri County was picked by His Excellency, the President, to pilot the Universal Health Coverage program. This was because Nyeri County ranks highest in non-communicable diseases in the country. We are, however, glad that through the assistance of this hospital, women coffee farmers in Othaya are getting medical assistance. Through this partnership, over 600 women have been screened for cancer, 53 of whom were treated on site, and 4 received treatment at the Aga Khan University Hospital. An important aspect of this partnership is the role of screening is having in early detection in the county. Through this partnership, cancer awareness talks and screening camps are empowering our people to seek help early. Ladies and gentlemen, continuous training of our medical personnel is a key factor in better health outcomes. In the last 3 years, 200 medical professionals from Nyeri County have benefited from a fully sponsored education session conducted at the Aga Khan University Hospital. In addition, we partnered with Karatina University and trained over 100 community health workers in the Mathira sub-county. And for those of us who understand a public health sector, you will agree with me that the employment of community health workers is one of the biggest game changers. There are many benefits to this system. The community workers are now empowered to offer palliative care, conduct basic tests like blood pressure tests, blood sugar tests, as well as conduct health awareness talks, which is a great component of preventive health care. Through them, we are sensitizing our people on healthy living, prompting them to seek medical care early, and helping those leaving hospital to recover very well from home. Ladies and gentlemen, our public health systems have faced many challenges over the years, from understaffing, limited equipment, poor facilities, amongst many others. Through investments from national and county governments and partnership, like the one we have with the Aga Khan University Hospital, things are gradually improving, even though needs are also gradually growing. Through the equipment leasing model, for example, we now have mammograms and MRI magnetic resonance imaging facilities. The gap, however, remains in the expertise. I believe that this is where partners like the Aga Khan University Hospitals and others can come in to help with the knowledge transfer so that we can be able to empower our hardworking and committed public health workers to do more. Ladies and gentlemen, as I wind up, I welcome all of you to visit our lovely, beautiful, green and serene Nyeri County to enjoy our great hospitality and even invest there. For those of you looking for partnerships to impact the community, our partnership with the Aga Khan University, Aga Khan University Hospital is evidence that we can take that seriously, and we shall do all we need to do as a county government to facilitate you and work with you to ensure maximum impact. Once again, allow me to express my gratitude to the leadership and staff of the Aga Khan University Hospital for the great work that you are doing and for hosting us here today. Indeed, as President Razul has said, a lot is expected of you in finding solutions for complex health and social challenges. And the world is grappling today with many challenges. And I believe that you are equal to the task. May the Lord bless you. Thank you.